Marfan syndrome is a connective tissue disorder that affects my vision, it affects my heart. I have some residual arthritis from it. It's not something that if you just looked at me on the street that you'd know I had it. All of my symptoms seem to be very subtle. So I do have the vision. I have slip lenses in the back of my eyes. One's a half moon, one's a 3/4 moon. And then I have the heart defect. I became pregnant. And because of the Marfan syndrome, my regular physician was concerned about the impact that the pregnancy would have on my body. So they referred me to Dr. Johnson, who's a high-risk OBGYN out of Manchester. And I started to go see him, and he was monitoring my pregnancy and making sure that I had ultrasounds and everything that I needed. It was then determined that my aortic root was dilating, and it was dilating to a dangerous level. And it was, I believe it was 5.05 centimeters, which was extremely dangerous. And it was at that time they sent me to Dartmouth-Hitchcock in Lebanon, where I met with Dr. Gerling and Dr. DiScipio. And we discussed my options. They gave me 4 scenarios. 2 of them I didn't survive. So a 50-50 chance wasn't good enough, so we made the decision to terminate the pregnancy and go ahead with the surgery. I had absolutely no symptoms whatsoever, other than what they saw on CAT scans and x-rays. I had no symptoms. I had no chest pain, shortness of breath, or anything that you would consider a classic cardiac event. I wasn't having any of that at all. My first impression of Manchester was wonderful. I felt very relieved, very relaxed. I really felt like I was in good hands with Dr. Johnson. He was very good to us, and he made sure we had all the DNA testing for the Marfan syndrome to see what the chances were we were going to pass it on and that kind of thing. So he really covered all our bases and made sure that we had all the information that we needed. He was absolutely wonderful. When the question came to whether or not I could successfully carry this baby, and we decided to include Dartmouth-Hitchcock in Lebanon. When we went up there, I mean, it was absolutely phenomenal. The people up there were great. They were, considering the topic and what we had to discuss, I mean, they were absolutely wonderful. They made sure that we had all the information so that we could make an educated decision. They strongly suggested, but they did not say you have to do this. They certainly, they said, if you wish to continue with this pregnancy, we'll support you and we'll do what we can to get you through it. But they also made no bones about the fact that it could be terminal for me, or it could be terminal for the baby, or both of us. I was absolutely terrified when they told me that I had to have valve replacement surgery. Not knowing what to expect, being so young, that's not usually a surgery that a 36-year-old person would have. But Dr. DiScipio, my surgeon, was wonderful in explaining the process to me. He explained to me exactly what they were going to do. He actually told me the difference between the valves that I could choose, whether I wanted a cow valve or a mechanical valve, and he explained the difference and the benefits of each. And so we were able to, together, we were able to decide which route would be best for me and which would work best for me. So I wasn't, at no time did they say, this is what we're going to do and this is how it's going to happen. We were very much a part of the process. Our wishes were respected, and we were given options, and we were able to choose our options. Dr. DiScipio was my absolute hero. He absolutely was. He held my hand literally through the whole thing, and he made the process, what was a very scary process, he made it not so scary. My prognosis is very good. I saw Dr. DiScipio on October 31st, and he cleared me for a year. My other local cardiologist, I saw him recently. He's also cleared me for a year. I'm good. I'm healthy and good. I had 2 aneurysms on my aortic root, and the aortic valve itself was defective. The aneurysms on the aortic root are really what was the most dangerous. Apparently, once he had opened me up and got in there, he realized that the aneurysms were so thin he could see through them. So I was very close to dissection. If I had dissected it, probability is I wouldn't have survived. The nurses in the ICU unit that took care of me, I mean, they were wonderful. I mean, I remember that when they sat me up for the first time, it was excruciating. And she said, "I know you feel like your insides are going to fall out, but they're not gonna," you know. And but they were all wonderful. It's like they all knew what I was going through, and they were just so supportive. I am absolutely indebted to Dr. DiScipio and to his team, and to Dr. Johnson as well for referring me to Dartmouth Hitchcock Medical Center, Lebanon. I'm just indebted to them. They saved my life. I can't put it any plainer than that. You know, they absolutely saved my life. They all came together. They worked as a phenomenal team, and here I am. You know, and I'm here, and I'm healthy, and I'm happy, and it's because of them. I no longer have a heart condition, and I love that.